I am here with Dr. Lisa Butler, a member of the advisory board for the Institute on Trauma and Trauma-Informed Care. My name is Tom Nochajski. I'm a co-director of the Institute along with Susan Green, and we're here to ask Lisa about her experience with trauma and trauma-informed care. So, to begin, let's just start with what made you interested in trauma? What started you on that pathway?
Well, that started quite a while ago. Actually, in my doctoral work, I'm in the School of Social Work as a faculty member, but I'm actually trained as a psychologist, actually an experimental psychologist. And in my doctoral work, I was very interested in what were termed discontinuities in experience. This was a notion developed by Philip Zimbardo. And so I was investigating that in the context of paranoia. But this idea of discontinuous experience really profoundly affecting the way somebody took in the world and reacted to the world was of great interest, and it sort of very naturally led, although Phil's work wasn't involved in this, but for me led to being very interested in trauma and the effects of traumatic experience. And so first I moved to a postdoctoral fellowship in the School of Medicine's Department of Psychiatry at Stanford to pursue that with David Spiegel, who is a sort of world-renowned trauma expert. And in that context, I was able to study trauma in many different contexts, including life-threatening medical illness and adult survivors of childhood sexual abuse and other contexts. And so it was really that. And then I was sort of hooked. Trauma is an incredibly compelling research area.
And again, you are well known within the context of the trauma area. How did your shift in interest to trauma-informed care come about?
That actually came about by moving to this school, I'm very pleased to say. Frankly, I didn't know anything about trauma-informed care. I had heard about Sandy Bloom's sanctuary model, but I hadn't read it, and so I didn't really know about it. And I didn't really get at a deep level what that was all about. When I came here, the school was in the process of about to launch a sort of reaccreditation proposal and then project. I was drafted by the dean to work on that committee. I certainly got very immersed in the area and became a true believer. I don't know how else to describe it. And the more I read, especially with all my background in research in clinical stuff in trauma, the notion of the importance of being trauma-informed and how you work with clients and work with research subjects and work with students across pretty much every domain became very, very clear to me. So that reaccreditation project where we developed a proposal and then the following year we ran all the things we proposed, as you well know, that was a terrific immersion in this idea and really sort of very much changed my way of thinking about trauma. And at the time, I remember I had just been involved on the APA's Trauma Division Executive Council, and I was a committee member. And, I remember talking to a past president of the division and a current one and saying, "Do you know about this trauma-informed care?" And nobody did. And so that prompted me initially, when I first got here, the summer I first got here, to write a brief article with a student here, Molly Wolf, on trauma-informed care to introduce to their newsletter, just to try to start to spread this word around. Subsequently, I've done some other publications. But it was amazing. It's a really, I think Fallett and Harris describe it as a paradigm shift when you get it. It really changes your perspective on the whole thing, and you can't really go back from once you've learned it, and it's very powerful. So it's definitely influenced me in a huge way in the last 4 or 5 years.
Okay. What I'm trying to kind of ask here is, you kind of touch on it in terms of how this has influenced your own personal work and then how that work potentially influences others out in the field.
Sure.
You want to just talk a little bit more about that?
I guess there's a couple different tracks I can take on this. One is sort of thinking through what it means to be trauma-informed in given contexts. And we certainly in the reaccreditation project did that with a number of sort of looking at agencies, the kind of services they provided, the ways in which they were and weren't trauma-informed, that kind of stuff. I also gave a lot of thought to what would be required to provide trauma-informed mental health care, and actually wrote an article on that with some colleagues. I'm really pulling together research both on the rates of trauma histories in mentally ill and related populations, and also trying to capture the real array of different practices that are routinely done and not thought about at all that can actually be re-traumatizing for patients and our clients. So that was another sort of little piece that really helped me. I have a strong background in psychopathology, and I really wanted to think about integrating that in that way. But additionally, I have 2 projects going on right now, 2 grants, where trauma-informed care is relevant. One of them is with a doctoral student, Janice Corello, and she's very keen on developing sort of trauma-informed educational practices out in secondary education. And so she and I have written an article the revisions are just being examined right now on that, on the ways in which trauma is introduced in classrooms in ways that, some ways of which are pretty irresponsible, we think, and how the kinds of things that secondary educators need to be thinking about when they're teaching. And she hasn't developed her dissertation yet, but it's going to be around that idea. Additionally, she and I have done some research this year looking at the potential for re-traumatization and vicarious traumatization among those in clinical training, because I think this is a really under-examined issue. There's been a big push of late, well, in the last 5 years or so, to make sure that trauma as a topic is introduced in clinical training, because it was actually pretty absent in many cases. And that's terrific, but what comes along with that is this potential for re-traumatization or vicarious traumatization. And so we did a study this year within the school that we haven't analyzed the data yet, but we've collected it, looking at, among our own master's level social work students, sort of histories of potential traumatic experiences and then their experiences in working, both sort of stress-related but also potentially secondary traumatic stress-related. And so we're going to examine that data and publish it. And we got a nice sample, almost 200 students. Obviously, the hope is that Janice's work on sort of humanities teaching and this work on clinical training will be able to publish it and get it out so that it can influence the way people think about the teaching. And this, as I said, trauma-informed care is so compelling. It's such a paradigm shift that I think that if you get that information out there and make a good argument, it really might have a big rippling impact on educational practice, both in clinical training and outside of that. So, and then the other project that I'm working on, that you and I are actually working on, is a large grant. It's a UB grant to develop specialized training for our students and also students in the School of Nursing here, working with veterans and military families. And a piece of that is certainly going to be about what does it mean to provide trauma-informed care to both of those groups. So there's certainly, it seems like this idea has really caught on for me because it certainly seems to be influencing pretty much everything I'm doing right now.
Again, the examples you provided certainly carry the trauma-informed care approach with it, especially the clinical training one, which tends to get ignored by a lot of places because they focus so strongly on the clients. So that's a really nice piece of work, right. I think. I think that's really going to be a nice addition. So one kind of last thing is, given that you're on the advisory board for ITTIC, the Institute for Trauma and Trauma-Informed Care, one of the things that we wanted to ask you is, what do you see as your best hopes for us, the Institute that is, in terms of forwarding the field in terms of trauma and trauma-informed care?
I guess my hope would be that the Institute would end up being a really sort of a central player in terms of developing and providing training in trauma-informed provision of services and sort of assessments within agencies and various places of their level of provision of trauma-informed care, both to their clients but also within the agencies as working environments. My fantasy is sort of boundless. I mean, I just think there's an opportunity here to really be this real hub in this, perhaps as a clearinghouse, although there's other clearinghouses right now, but clearinghouse, but a real central training place so that people from all over the area, and maybe nationally, I'm not sure if that's in your plans, but certainly the whole Western New York, Southern Ontario area would say, here's the place to go to find out about this, to be trained in it, to all that kind of stuff. So
it's pretty much in line. The only thing that I would potentially add to that is, and because, as you know, that the trauma-informed literature doesn't have a lot of solid empirical evidence. That's stuff that I think we should start to provide in terms of looking at outcome. For instance, with your clinical training, you identify areas where training is needed. Okay, well, let's look at the outcomes for that and see what happens.
I'm hoping you'll help with that.
Yes, exactly.
I agree. And it's sort of complicated with trauma-informed care because Most of the research that I've seen, the empirical stuff that I've seen that's out there now, has been where there have been sort of large randomized trials where trauma-specific services are also provided. And so how do you tease out? It's very hard to tease out the trauma-informed piece alone. And both practically, but also if you think about it theoretically, how do you tease that out?
Yeah, and again, some of the things that I've been thinking of, for example, would go along with that. What we would like to see is, okay, we go into an agency, we assess them, we find out, okay, they're really not doing trauma-informed care. Let's train them in the process. Now let's look at the outcomes for the clients. Has that shifted? Right. Are they becoming more positive as a function of that? Let's look at the outcomes for the staff.
Right. Yeah,
What
I think that's
there?
where you're really going to see.
So again, I think there's a lot of opportunity. It's just a matter of getting the funding to help us do the process of this evaluation and stuff like that. So I like your ideas. I think this is really great. What continues to excite you about your work?
Well, I get excited by work that is sort of theory-based, idea-based. And particularly, I mean, not to keep harping on trauma-informed care, but that is such a powerful notion. And it's also a sort of a feel-good notion in the sense that when you're working in it, if you're making changes that are consistent with trauma-informed anything, it feels very, very gratifying. So I get tremendous satisfaction, for example, not only just doing the kind of research I described, but mentoring students, teaching students about these principles. I teach in the required class we have here, one of the sections on trauma and human rights, and to have students come out going, now I really get it. And you can see it in their assignments that they're really, really, they've got their principles and they're applying them and they're thinking about them in very clever ways, and they're recognizing the challenges within whatever population they're working with. That's very gratifying too. And also have students like I have right now who are so excited about these ideas and they're taking them off on whatever their particular path is. That's tremendously gratifying too.
That sounds great. I think I'm finished unless you have anything else you would like to say.
No, I think that's it. I guess I want to make a plug for ITTIC because I just think this is a tremendous opportunity for all the things we've been describing. I think it was needed, the time was right, and I really wish ITTIC all the best for the future.
Well, thank you.